Immediately with a short introduction of this session, which is called the current situation of global remote healthcare. Before starting this session, I would just love to agree on what remote healthcare is. There are many definitions. There are many definitions of remote healthcare, but the one I like personally the most and has been agreed long time ago, it's the remote location is defined as far as medical issues are concerned, a location where evacuation to a hospital cannot be guaranteed within 4 hours due to distance, inclement weather, lack of health structures, transportation stations, and so on and so forth. So if we can all live with this definition, then we have to assure that the management of health on these locations is not in first of all interest of the employee, because they need to become healthy, stay healthy, and go back to their families healthy. It is also company's duty of care, because the company has to have a legal obligation to assure that the health of their employees, regardless where they work. And last but not least, it's also a legal issue, because as I said, in many countries, there is a law that obliges the company to take care about its employees. When we are looking about the healthcare at remote locations, then there are so many issues that we should be discussing and talking about. Where we came from, where we are, and where we want to be in a health management system in remote locations. We are living in a changing world. We are facing new challenges. We are facing expectations. And of course, the remote healthcare management is changing. We have to see what is the relationship between local laws and regulations versus company worldwide standards. In many countries, the local requirements are much below the standards our companies are having. Organizational issues, how the structure of healthcare functions, how it was functioning yesterday, how it functions today, and how tomorrow. How do we match with international health management standards, ISO 5001, standards of equipment and personnel, educational preparedness of healthcare medical personnel? We know that our medical personnel in remote locations are expected to be allologists. They have to be specialists. They have to be general practitioners, surgeons, cardiologists. So what are the qualifications they need to have? And not just to be picked up from a hospital environment or from a city environment and just place remote location, just ticking the box saying we have a medical personnel there. Now, there is more and more e-health and remote and telemedicine are taking place in remote healthcare management. What is their role? What we can see, how they can be using best interest of our employees and companies. How to prepare the employee to go and work at a remote site. What are the risks, not related only to the work, but to his age or her age, genetics, chronic diseases. Know how to assure that his health is not jeopardized when he or she is working on the remote site. Definitely management of the emergencies. How are we going to deal with the emergencies, considering weather, considering transportation, considering local facilities? Mental health at remote locations. because we have people working 12 hours away from their families, away from their everyday problems. So even this is an aspect that we should consider. Food and hygiene on remote location. It's not only the quantity, it's the quality. It's the assurance that the food is healthy, that people are given the opportunity to eat the food that is fresh, healthy, prepared for their health status, so controlled in calories and balanced with all nutrition. So there are so many issues that can be discussed at remote healthcare. Of course, in today's session, we will not be able to address all of them, but we have 7 wonderful speakers. We have 7 wonderful topics that we are going to discuss, and to hear how they are discussed. You will hear all of them, and the 7th one that I have the pleasure to announce also Dr. Nahyan Helal, who found time to join us at this conference. So enjoy the discussion, enjoy the session. Feel free to ask any question through our Q&A function. Unfortunately, we will not have too many time for the discussion, so the first who sends the question, the first will be answered. Well, as the time is running quickly, I'm happy to announce the first speaker, who is Professor Sergei Antipov, the host of this conference, the host of this session, who is a PhD and surgeon and professor at the Siberian State Medical University, with more than 85 scientific papers that have been published around the world. Founder and general manager of CTN Company, delivering medical services worldwide, as well as CIVMed Center Company, specialized in occupational health management. Professor Antipov, thank you very much. The floor is yours.
Hello, dear colleagues. Thank you very much for this nice introduction. Before starting my presentation, I would like to thank Frana Mika for being the moderator of today's session. Frana is a well-known international expert, a good friend of our company. He was twice in Tomsk. It's a pity that he is not able to come today and not join us, but nevertheless we're happy that he is able to join virtually. And I'm special thanks to Dr. Nahyan Hilal from Abu Dhabi, who was also kind to join us. As Frana mentioned, we will have different reports, and we will talk about remote healthcare in Indonesia, in the Eastern countries. We will cover this topic in Russian countries, and I hope the information will be diverse and will be interesting to you. We will try to answer the questions as much as possible. So the topic of my presentation is called Provision of Medical Services at Remote Industrial Sites in Russia. The distinctive feature of remote healthcare in Russia is the fact that Russia represents a remote healthcare system. As you see on this map, 2/3 of the territory of the country with the low population density, the greatest population is concentrated in the European part of the country. So here we see all the difficulties that the remote healthcare system is facing. In the Urals, in the Far East, in the Arctic, in Siberia, in low density areas with difficult access, the situation is not so promising, but in terms of their development, they present a lot of interest in terms of their economic growth, and that is why the issue of providing remote healthcare at remote sites in Russia is quite relevant and urgent. And this can be confirmed by the speech of the President of the Russian Federation at the Eastern Economic Forum, where he said that it is necessary to reformat the medical health care at remote sites in the country, particularly in the Far East, Federal District, in Siberia, and the Arctic zone. The structure of medical health care that we have today in Russia is efficient, but it is more efficient in the European part with many big cities. But it's not fortuitous that we hold this conference in Tomsk, because this is a territory which is characterized by a variety of remote facilities, remote sites, and hence we want to share our experience of working with these remote locations, and also share our vision on how to tackle these issues. So Frana already described his understanding and our common understanding of the remote healthcare system. We divided this into two units: rural remote healthcare and industrial remote healthcare. This is a relative division, of course, but nevertheless it is accepted worldwide. And I would like to focus on remote industrial healthcare in my presentation. But concerning rural and industrial remote healthcare, the common thing is that the primary healthcare setting is common for both of them, which in Russia is undergoing different reforms and is quite relevant in Russia. Talking about rural remote healthcare, this consists of central regional hospitals, rural district hospitals, and first aid stations, all belonging to the central regional hospital, of course. This is the particular feature of development of the state and how the state medicine is organized within the obligatory medical insurance. This is a separate division of science, quite interesting to my opinion, and I would like to talk more about industrial remote healthcare, which is a closer topic to most of us, and we work in this area for more than 10 years. So industrial remote healthcare can be relatively divided into offshore and offshore units. In the plenary session, there was a report on industrial marine medicine. This is quite relevant and important. And remote industrial marine healthcare is part of the remote industrial healthcare in general. What do we have at present concerning the industrial remote healthcare? How the medical services are organized? Those experts that deal with remote healthcare, they know about this. The classification is quite simple. There are medical centers of the first level, of the second and third levels. And lately, due to known reasons, we have observation facilities and isolation units. This is caused by the COVID pandemic. I already mentioned that particularly with regard to Russia, the remote healthcare is widely spread in Arctic zone, in marine medicine, in mountain medicine, and in air medical service as well, which is caused due to the changes of the physiological state of a person when in the mountains, for example. So all these areas are quite interesting, and we want to push this issue forward, especially after we opened our branch in Bishkek, near the mountains, where they are quite active in different industrial facilities. And together with our Kyrgyz office and our Russian potential, we will be able to unite our efforts and use our experience of the Institute of Healthcare in Scotland. We will try to solve the issues that the organizations are facing at a different level. Air medical service here occupies a separate place and a very important place, because medical evacuation, as already mentioned, is a necessary component of remote healthcare. These are tasks and objectives of remote industrial healthcare. They are all listed on this slide. In general, this is to provide first aid and emergency care. First of all, this is urgent and emergency healthcare to ensure pre-shift examination, to put drivers on route, that is to arrange different tests for drug and alcohol addiction for drivers. These are the basic tests that all the drivers have to pass before going on route in remote sites. Besides, there is a need to organize and arrange medical evacuations. This is a separate division that requires special training, special organization. And today, during the forum, we talk about this air aviation and air evacuation. We try to engage the government authorities into solving this issue, but at present, the medical evacuation by helicopters is quite important, especially in Russia, because this is not the only, but one of the major ways to evacuate the injured and sick people from a remote site. We also talked about the control and compliance with the hygienic norms for food, accommodation of workers. These are also important aspects, not typical for Russia, but for the entire world. All the medical people have to keep track of the health of their employees. And another task of the remote healthcare is to develop a certain model that would ensure communication with the leadership of a remote site and medical support team, because no particular efforts are made in this regard. We need to ensure proper communication with the customer, at least, how to understand the technical process, so that they know what are the potential risks and hazards that the employees might face during their work. This happens in our company from the headquarters, that we receive all the instructions. And this is very important for us, because the success of the company in general depends on how well the communication is built with its offices and branches, and how people communicate within the company and each division. What medical personnel we have at these remote sites? These are paramedics, doctors, but in Russian reality, these are different types of doctors. We have these emergency team doctors, general practitioners, Many Evgeny will tell us later how it is used in his location. So these are the key medical staff that work in remote industrial sites. Paramedics cover about 80% of the medical services at remote sites in Russia at present. So the levels of medical centers, the first level, second level, and third level. First is the paramedics, the second is the doctor level, and the third one is the multidisciplinary, which is a primary specialized medical care in hospital conditions. There is a need to have more third-level medical centers, which is quite interesting, and we have a few of those in our remote locations, but this is something we need to strive for because they are the future of remote medicine. A separate emphasis should be placed on the licenses that control and regulate all the medical activities, and one of our proposals to the Institute of Remote Healthcare is that we need to make sure that our customers understand that the provider should have a license that includes all types of medical activities, includes all the specialized doctors, emergency team. The second aspect is the license for medical care at a remote location. The third aspect is the presence of a license for pharmaceutical doctors for keeping drugs and administering drugs. Because when we talk about the third level medical centers, the demand for drugs for different medical drugs is quite high, and so that not to expose neither customers nor yourself as a provider to any risk, we need this general license that covers all possible cases. And fourth aspect is the drug tests. This is a controversial issue, but the international practice shows that some international companies have this type of license. In brief, I would like to show here as some standard how similar work is done by our company, by the Center of Corporate Medicine, since we are the main provider of Siberian Medical Center. We have a base. The location is in Tomsk. Then we have remote sites, let's say in the Arctic zone. We have the basic license that covers a wide variety of medical services and allows us using telemedicine within the framework of the Russian legislation. When some people say that for telemedicine we need only a phone and nothing else, this is a fake, and the customers should understand this clearly, because within the framework we should possess a basic license. In case of any address for medical assistance, you see our medical person approaches this situation. There is a consultation between medics. This is also within the framework of the legislation. This is what was mentioned by our colleague from Kyrgyzstan, that they do not have this legislation. And right now this is quite legal in Russia. The medics are able to talk with each other and consult each other. You see how the communication process takes place. A very important task is to communicate with hospital the potential place for patients or injured or sick people from a remote site, for example. This system is well developed. Here in Russia you see the consultation, then we consult a helicopter provider. This is done by the call center, our managers, project leaders, and so on. Then we send the injured person via the helicopter. We reduce the amount of evacuation due to special training of our medical staff and telecommunication talks that reduces the number of these very expensive evacuations. So a patient is evacuated. This is the history in general terms, how we see it. And I gave this example for your discussion. Unfortunately, I'm running out of time, so thank you for your attention. Thank you.
Okay. Sorry for interrupting you, but seven speakers. Thank you very much for presenting your activities in Russia. I already have some questions for you during the last session, question and answers. And we need to go to a second speaker. I'm extremely pleased and happy to introduce from Brazil, Dr. Paolo Antonio de Peira Robello, my great friend from old days. Thank you very much for accepting this invitation, as it is like 3 o'clock in the morning in Brazil. Dr. Robello is specialist in occupational medicine and has PhD in toxicology and toxicological analysis. He has an MBA in health management. Presently works as a medical doctor of Brazilian oil and gas company Petrobras. Has experience as a doctor, manager, professor, and writer in the field of occupational medicine, epidemiology of cancer, inclusion of people with disabilities in work, ethics in medicine, and health management. My dear friend, Paolo, please, the floor is yours.
Thank you, Frano. I will show my presentation. Good morning to everyone. First, I would like to thank Frano, Sergey, and the organizing committee of the International Conference for inviting me, and to my colleagues in this section for the opportunity to be here and together. I declare there is no conflict of interest in this presentation, and I will speak from my personal convictions with no connection to any organization and institution to which I am affiliated. This is our agenda. Offshore activity are one of the most important activity in Brazil that use a remote healthcare service. And this is an activity that we increase in use of the remote resources. And we observe an improvement in the service offered for large hospitals in telehealth services. Other important support is related with aeromedical rescue. And this is important to rescue the person and give support during a period that the people waiting for the rescue. Because sometimes we have a weather condition bad, then we needed to proceed the rescue. Other point of attention is use of devices to assessment for remote monitoring people in this place. Physicians and managers pay attention in the pre-embark assessment, in special for chronic disease and dental problem, because this avoid rescue. If we have people with their chronic disease under control and treatment of dental problem, we avoid a rescue. Other point is because we have a lack in offered of communication right speed, and sometimes this make it difficult, if impossible, to use of these resources and support during the activities of remote care. Another kind of activity that we need the support of remote care is activity inside the forest. In these sites, we have a long distance and poor local resources. And the major projects in mining and oil and gas are in this region. The long distance make activities depending on air or river transportation, which is expensive or time consuming. Sometimes to remove a patient using river transportation, we spend 2-3 days. And it's important to receive support during the medical attendance. In this area, we have a difficulty in communication. Sometimes is so limited. And companies need to create their own structure in health in places to attend emergencies and to give support in medical activities. There is necessity to increase the use of service, the remote care service. And we need to train medical staff in use of health technologies. Activities on long-haul ships. Each one of these activities have their specifics, characteristics, and needs. In activities in long-haul ships, you have only basic health structures and vessels to transport containers or oil and gas products. The health team to remote support is available in company or using international support base for attending emergency and health problems. Another difficult is the rescue and service for health assistance when necessary, because sometimes the ship is so far and there isn't near resources to help. We are in a country with different geographic and health resource distribution. Then we have activities in areas without local health support or poor health support. Then are example of this activity, the construction, transportation, and pipeline activities. All these activities for a short or a long time will be necessary to remote medical support. Then it's so important to have a plan for emergency care and removal person to urban medical care centers. This is mandatory. Then we needed to talk about the activities during the COVID-19 pandemic. This period changed a lot our way of work, and we needed to monitor employees who work in activities in which they are present or the same time as it is necessary to provide support in the diagnosis and guidance for suspected and confirmed cases in the group of home office employees.
Paolo, I'm just kindly asking you to take care about timing. Please take care about timing because we need to stick in.
Okay.
Sorry, thank you very much.
Okay, I'm finished. And we needed to monitoring the pre-shipment, quarantine, and suspected case to implement a health surveillance for employees and assessment of suspected and confirmed cases and support for isolation, transport, and emergency case care. Finally, we observe a growing demand for remote care service, increased support from hospital-based health teams, using monitoring with wearable devices, increased use of high-speed data transmission to permit the use of new technologies in healthcare devices, and we have a great regulation and use the telemedicine support. Thank you for your attention.
Thank you, Paolo, very much. Thank you very much. What I remember is just focus on training personnel, new technologies, and health. Thank you very much. I have a pleasure now to announce another great friend of mine, a great colleague, a great team, a great friend, Dr. Susanne Schunder-Kasper. She is medical doctor with postgrad at the Austrian Academy of Occupational Medicine. He has a diploma in emergency medicine, occupational health, and environmental medicine. Actually, she is the head of IMV Corporate Health Management and president of Petromed. She does great voluntary work at the Red Cross organization in Austria and many national and international professional organizations. Suzanne, thank you very much for being here. Thank you very much for being with us. Nice to see you. The floor is yours.
Hello, everybody from Vienna. I want to thank you for the invitation. I want today focus on the aspect of quality management for occupational health organizations. When we normally talk with people what is quality, we hear, oh, something is good. But the definition of quality is that's the totality of features and characteristics of a product or a service that bears on its ability to satisfy stated or implied needs. So this is something, if we work in the fields of occupational health and quality management, we have to focus on this traditional definition of quality and not what the ordinary person's idea is, that quality is equal of good. We want, if we take care on quality and whatever quality we want to discuss, it's always important to start with the preventive aspect. And we have to be clear that it takes time and that in every process, in every service, there is an improvement area, and it's clear that it takes time to achieve changes in this field. When we discuss quality management and health, and especially occupational health, then certainly these ideas have to be influenced by the ISO 9005, the ISO 14050, and the big influencer is the British standard for occupational health and safety. But this certainly had all influences from IOGP, from the International Labour Organizations, from the International Commission on Occupational Health. So if we think on quality, we always have to look what is state of the art in the respective fields. What is ISO? ISO is the International Organization of Standardization, and they try to achieve and maintain standards of quality. And it's quite an old organization. It was founded in 1947, and over the years, more and more ideas for standardization have been developed, and one of the last was the, for us, important, the ISO 14050 for occupational health and safety. And the ISO is a partnership, and it works in many, many countries, around 150 countries around the world, as well for public and private sectors. And I think this is one of the most important aspects for ISO, for all the ISO, and for all quality management, that we aim for continuous improvement. And here we have this traditional so-called Deming's wheel, according to one of the forefathers of quality management, that we have to plan an activity, that we really have to do something, we have to act on it, and we have to check if we really have achieved this, and then start this circle anew. In the field of occupational health, we have always to deal with these so-called factors of influence. And worker and employee is exposed to many factors of influence. The work environment, and especially if we speak on remote healthcare, it's cold, it's hot, it's far away, with which kind of tools the people have to work, what kind of material they work, but certainly also some of the nowadays often called more soft influential factors on how is the work organized, what kind of information technology they use, what is the culture in the company, what are the management systems. And all these we have to take into account when we want to think on occupational health and quality of our service. And first, I have shown you these naming wheels. And here in the Austrian Academy of Occupational Medicine, we have developed a model which fits more for the occupational health fit. First, we have to analyze the influential factors. We have to see what is the health of the people. And then we have to develop concepts and to make arrangements and to start to implement them. And the doctors cannot work out of the sky. Certainly the most important issue that we have to communicate with leadership, with people, with union representatives, and we have to do this in cooperation. A single doctor cannot do anything. It needs the whole organization. You all are aware of this old traditional WHO defined definition on how to define health. And I think it become more and more important to focus on these physical and mental aspects of health, because nowadays, and especially the COVID crisis showed this, that a lot of people are not only impaired physically, we heard before also this aspect of chronic disease, but the crisis of Corona demonstrate very clearly that more and more people are exposed to mental health risks. And if we think on health standards, we have to think on how to organize this in an organization, that we could have a similar health care, a similar care for our employees. And I focus on the word similar. You never can have the same health care if you work internationally. The healthcare system are different, but the main aim of all our activities should be to improve and promote the employees' health, as well in physical, mental, and social well-being, to promote the working environment, to try to prevent of occupational health risks, and also take care that the health of the employee is assessed, monitored, and managed. And if we go into a process of planning, this health risk assessment are the important aspects, the starting point, the springboard. And here just some ideas what you have to think about, from chemical, physical, epidemiological aspects, what are the ergonomic work conditions, what are the work procedures. And out of this, when you have collected the risks, we can think also what are the results from medical examinations, what do we know on chronic disease, and certainly and therefore health never can be the same in every country, to think on what are the local legal requirements, they differ quite widely, and to evaluate health performance indicator, defined health performance indicator. Also, it's important to think on how to make occupational health audits. And there, this strategy has to be overseen by office, and if this person is called the corporate chief medical officer or whatever, it's important that somebody has an eye on it. And health could not stand alone. It needs to be integrated in the overall HSSE and quality strategy of an organization. If we think on quality, we also have to see on qualifications of our medical staff. We have to think on what are the minimum extent of medical service. If we are in a remote desert or other remote area, we have to see that there is 24 hours around the world every day this care. For other places, maybe it could be reduced. And also always think on trainings and retrainings of those people. We have to see on this pre-employment assessment, Paul already talked about, on the country-specific obligatory health surveillances, and also on voluntary medical checkups. And what we focus in the last years here in OMV is also on the expatriate medical checkups. If we send people abroad in remote areas, we have to be sure that we know about their health problems, and maybe sometimes reject people to go somewhere in the middle of a desert or in a remote area on a platform. For instance, if somebody had a kidney transplant, maybe this is not the best place for such a worker. And to think on how to provide curative health care for these people. Preventive, large field of travel medicine, vaccinations at the moment, COVID vaccination, health circles. And certainly we have to train the people. Frano mentioned already that I'm really internationally involved in the Red Cross and Red Crescent organization. First aid is an important issue, but we also have to give general health training on lifestyle, on drugs, on health risk, and so on. And when you set up your health standard for your organization, it needs to include a lot of other aspects like kitchen hygiene, which is an important aspect in a remote healthcare environment. We already talked about the emergency preparedness, the health impact assessment, what impact does our activity have. We have to document our activities and also think on legal requirements of confidentiality, how to inform people, how to communicate with the company, and also how to organize the auditing process. And it needs to think on what are the minimum requirements for clinics, for office clinics, for remote clinics, for RIC clinics. What are the basic medical equipment which maybe need to be enlarged in very remote area? How does an ambulance car should look like? Here you have some example from our OMV clinics worldwide. They look quite similar and they have similar equipment worldwide, even if it's in the desert in Tunisia or somewhere in New Zealand or in Romania. What is an important process? We need alignment with the senior management. If we don't get the approval and the ideas of the senior management, it will not work. And then we have to train the local doctors, and we have to do project plans. We have to give those people guidelines for auditing. And certainly we also need to know what's going on in these countries. We need reporting structures, communication structure. And such a process never comes to an end. It's always a continuous improvement process. So these were some of the ideas I wanted to share with you. Certainly we could speak here for many longer times, but I think for this presentation or for this session, it's now enough, and I'm looking forward for your questions. Thank you, and all the best from Vienna.
Thank you very much, Suzanne. Thank you very much indeed for this very interesting presentation. Yes, Key points. We need to work on standardization of the health management system. Doctors are not isolated, they are not an island, they need to work within the teams and with other functions, but most important and most relevant is train the medical personnel in working at remote locations. This is a top, main issue and really something that we as medical doctors organization should work at. Thank you very much, Suzanne. Well, the next speaker is, again, an old friend of mine that I haven't seen for ages, but we've been working together and also publishing some important papers around the world. My dear friend, Dr. Will Ponsonby. I'm not going to list everything that he did in his life, but just state that he's immediate past president of the Society of Occupational Medicine. He's an independent occupational medical consultant after many years working in the oil and gas industry and emergency management. He is now also a senior lecturer in occupational medicine at Manchester University and occupational health consultant. Well, nice seeing you. Thank you very much for accepting this session, and please, the floor is yours.
Thank you. Do I need to share my presentation, or will they bring that up?
If you would share your screen so we can see your presentation, it would be very nice.
Okay, great.
Пока идет подключение, хотел бы.
While we're
About today is medical evacuations, but normally we talk about medical evacuations and how we arrange them and how we make them most efficient. What I want to talk about is some of the things that we need to do to avoid medical evacuations. When we're working in remote and inhospitable areas, if workers become ill or injured, then medical service is often rudimentary, and therefore we have to evacuate them either to a local medical centre or to a centre of medical excellence. Medical evacuations are very expensive, and they're also very disruptive to the operations. And although we must prepare to be ready to do medical evacuations, we must also look at our health and safety plans on the site to try and minimise the need to do them. One of the first things that we have to do is do a health risk assessment for the site. We need to look at the location of the site, the distance to medical care, and also the mode of evacuation, how we're going to evacuate people. We also need to think about time to specialist hospital facilities. There may be a local district hospital which has basic surgical facilities and basic cardiac care, but for certain conditions such as neurosurgery or burns, you may need to go to a specialist facility which may be very distant. There may only be one such facility within the country you're working in, or indeed there may be no facilities in that country and you may have to evacuate internationally. You also need to think about climatic conditions, and these can affect the evacuation. In some countries, climatic conditions vary considerably between summer and winter. In other countries, you have monsoon, which may considerably impede evacuation, and all of those have to be built into your risk assessment. You also need to think about the endemic diseases in that country, any infectious and vector-borne disease prevalence, and be prepared to treat those diseases. You also need to think about geopolitical considerations. I was working on a project in Iraq, in Basra, and we were very close to the border with Kuwait. And in Kuwait, they had very good world-class medical facilities, but it was impossible virtually to get reliably evacuate by road ambulance across that border. So we had to evacuate to Basra airport and then fly people out to the United Arab Emirates. So geopolitical considerations and whether borders are open, whether you can pass easily between countries, are also very important when you're planning your medical evacuation plan. You obviously need to have a medical emergency response plan, and this needs to be well in place and well documented. all relevant parties need to have copies, and they all need to have the same copy. So you need to make sure that you have a good process for updating the plan and communicating that to everybody. And it needs to be accessible in the site clinic and for managers on site. I think one of the important things about medical evacuation is to make early contact with the assistance company and discuss the case with them. And often if you do that, you can plan the evacuation and put it into a window when it's most convenient and safest to do it. You can do it during daylight hours, you can do it before the weather changes, etc. And also by early consultation with the assistance services, you may be able to make some interventions which means that the evacuation is not necessary, or you can do it on a routine crew change flight or transport. And I've already talked about planning for daylight and also planning for windows in the weather. A study of medical evacuations from the oil rigs in the Gulf of Mexico showed that for older workers, medical problems were predominated as the reason for evacuation. For younger workers, injuries was the main cause. And this is partly because obviously as we get older, we have more medical conditions, and partly as well because I think that older workers tend to be more careful and younger workers may take more risks. Of nearly 1,500 calls, only 47% resulted in evacuation. And I think this kind of shows that by discussing with the assistance company, often the condition and the situation can be resolved without having to resort to evacuation. The other interesting thing is that 77% were for non-occupational illnesses and injuries, and the main cause of illness was chest pain and abdominal pain. So that means we need to make sure we've got services on site to deal with those conditions. So we're able to take a good ECG, we're able to send that ECG for an expert opinion, and also have facilities perhaps to thrombolyze someone on site so that we don't have to evacuate them so quickly. In the UK offshore sector, in the early 1970s, the main cause for evacuation was injuries. And that was when the sector was new, health and safety probably wasn't as well advanced as it is now, and more risks were taken. Now the sector is much more mature and the workforce is more mature. And so now we see in the offshore sector there that illnesses are the main cause for evacuation. The other interesting thing is that most of these facilities offshore in the UK sector now have the ability to thrombolyze patients for myocardial infarction, and they boast that they're probably the fastest response in the United Kingdom, in that if somebody is ill, they can have an ECG taken, it's faxed to the local emergency department in Aberdeen, and they can give the instruction to thrombolyze people immediately. So, you know, a really first-class service. You obviously need to develop site medical services to treat and stabilize people and hold them until you can evacuate them. You must consider what the facilities are, what the risks are, the personnel, the equipment. You must also have the backup and the telemedicine, as we've already discussed, and this can really help to mitigate the situation. Cardiac assessment, ability to thrombolyze. I've put down here surgical capability, blood, and sustainable with big question marks after them. I think on lots of occasions I've been asked to kind of look at putting a surgical capability on site, and actually it's very, very difficult to sustain and very difficult to achieve. And similarly to have blood and blood transfusion on site, very difficult to achieve and sustain. And although they're often requested by clients, in the vast majority of cases, it's not possible to do that in a sustainable way. And when you have your medical evacuation, you would arrange it with a tiered response, something like this, which I'm sure many of you are familiar with. And there are slight different variations on this, but first responder, designated first aid, then a paramedic, doctor, ACLS, ATLS on site in your site clinic, and then evacuation to a hospital, surgical facilities, etc. It's very important, as we say, as I've already said, medical conditions are now the predominant cause for medical evacuation. So therefore we need to do a full medical assessment before people go to work on remote sites. So we should take a full medical and drug history. And if if you get the full medical and drug history, that's one of the most useful things for predicting future problems. Also, a clinical examination. You may need to make a referral for diagnostic tests or a specialist referral. Check dental fitness. It's very important. A lot of people have dental problems on site, and although it seems quite minor, it actually is very painful and debilitating, and they may need to be sent away for that. So making sure people are dentally fit is important. Mental as well as physical health. People with mental health problems, often going to work in remote locations exposes them. They're away from their family and friends, away from their support organisations, and it can result in mental breakdowns. If you can, it's good to use a recognised standard such as the OGUK Offshore Medical Standard or the International Maritime Organisation Standard, and that's because that's well known, that those are well known globally. We don't need to exclude all medical conditions. We're not looking for kind of supermen or superwomen to go and work on the sites, but what we want to see is that people who have medical conditions are managing them and that they're stable, so that they're taking their medication, they're managing their diabetes, they're keeping their blood sugars in reasonable levels. And this can be a difficult balance between excluding people and facilitating people with the skills and knowledge that you need to work on site to go and work there. And those of us who work in the remote medical arena will be very familiar with that dilemma. I also just want to raise a caution about accidents during evacuations, and helicopter evacuations can result in accidents. These can be due to pilot error, defective design of aircraft, negligent maintenance, police or ground paramedic errors, adverse weather conditions. So I've kind of been involved in medical evacuations, or I had sight of medical evacuations which weren't really necessary. They went ahead and then there was an accident, which was very unfortunate. And with more planning and better advice, that evacuation could have been avoided altogether. I think another thing is that adverse weather and flying at night both significantly add to the danger of doing evacuation by helicopter. So this was looking at helicopter ambulance deaths in America for over a period of 15 years. So from this you can see that there were 80 medical helicopter accidents during that time with 217 deaths. So quite significant. Main causes were human error and also that poor weather conditions made accidents much worse. And although only 19% of the accidents were due to poor weather, they made up for 56% of the weather-related accidents were fatal. Also, road ambulances are not without their risk, and again, these are figures from the United States. 6,500 accidents involving ambulances, 35% of crashes involved an injury or fatality.
2 minutes warning, 2 minutes warning.
Fine, I'm nearly finished, thank you. So one of the things that's interesting is that the majority of the fatalities were in other vehicles, not in the ambulance. But again, I think the message is that we need to make sure that we're minimising the need for evacuation. So we need to have good site safety management, a good health and safety management system. Road traffic accidents are one of the main causes of injuries, so we need to make sure we have a good vehicle management plan. And then we also need to make sure we're managing the evacuation. And it's the site manager who makes the decision on the evacuation. He needs to take all of those things in account. He'll be advised by the site medical staff on whether on the medical need for the evacuation, but he has to take into account weather and other daylight and other factors as well. Just finally, just to say that I'm a member of the Society of Occupational Medicine, and we have an international group around the world, and we look at some of these issues of occupational medicine and how they apply in the international sphere. Thank you very much.
Thank you very much, Phil. Thank you very much, Phil. Really great presentation. And the sum up would say you fail to plan and you plan to fail. Of course, prevention is much better than cure. So whatever we do to avoid emergencies means that we are managing the emergencies. And very interesting issue is that 77% of evacuations were due to medical issues rather than to injuries. We are talking so much about safety and so little about health, which at the end of the day, it's like 75% of our job and of our issues that we have on remote site. Thank you very much, and we've passed to the next speaker, who is Dr. Evgeny Lubali. He is experienced in emergency medicine, ATLS, ITLS instructor, did many health impact assessment, health risk assessment, health management plans, and emergency procedures for corporate customers. Presently, he is medical director and medical services international SS in Russia. Dr. Evgeny, do I see you? Yes, you are there. Thank you very much.
Thank you very much.
You are muted. You are muted. We can't hear you.
В зале вроде меня слышат.
Sure.
Добрый день, дорогие коллеги. Прежде всего, разрешите поблагодарить.
Hello, dear colleagues. First of all, I would like to express the words of gratitude to the Center of Corporate Medicine for inviting me to participate in this discussion and to present my speech and share my experience. When I received this invitation, it was quite unexpected, to be honest, and we thought, what can we share with you so that it will be fruitful and useful and something new? So at the end, we found a topic that you see on this slide. The topic is called provision of medical services at remote sites during the COVID-19 pandemic. The first part seems quite simple, but the new part is different. Current and future issues, what we see and what we shall expect, physical and psychological recovery of employees as a new benchmark for effective work. These are the contents of my presentation. I will not spend too much time on this. The first thing I would like to emphasize in my presentation is the definition of health by the World Health Organization, which was already mentioned today by some speakers. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. For quite a long time, we have paid attention to the main part of this definition, lack of diseases. So we assessed employees in terms of the absence of diseases, in terms of different signs that prevent them to work. And sometimes we paid attention to the physical comfort, but the social and psychological aspects were never covered. We never paid attention to those matters. And in this regard, I would like to suggest transforming our mindset today and improve it a little bit with regard to health and what are the benefits of each of these components for our employees and for the company. Interesting, but the coronavirus helped us to understand the situation in general. This can be characterized by this cycle. The coronavirus that once came, it will never disappear. We will have to live with it and try to cope with the conditions that it brought to our lives. But it brought a lot. In fact, different effects that I will talk in details in my presentation. First of all, we need to understand how to prevent our employees, our staff, and the people around us and ourselves from this pandemic. No matter how hard we tried, there is no single formula for the protection of our health. So that is why we decided to follow the Swiss cheese principle, which implies different layers. I will not mention them. You all know them, I believe, and you see them on the slide. But each layer has its holes that do not provide comprehensive protection. But in a general view, the use of all these layers in combination brings a good effect and in terms of the prevention of different diseases. What did the coronavirus brought? It brought changes in the work mode of employees in remote sites. There was a need for quarantine before the shift. Check-in testing was also required, is now also required. The shifts were extended so that to avoid contact between workers, and as a result, apprehensive attitude to others. I believe that you saw a lot of, and you know a lot of methods and techniques to monitor the health of employees, and here we see how some different techniques such as the rapid antigen tests or PCR laboratory tests. And on this slide we see the probability in percentage of infection. These data are obtained from official studies carried out by the experts of our company. There is an International Science Foundation, and these data are provided by this association. Besides changes in the working modes, there were new challenges in providing medical treatment and support to workers at remote sites. First of all, as you remember, in 2020 there was temporary full suspension followed by limited access to planned medical care, including pre-employment medical checkups. Limited opportunities and of these examinations, there was a need to temporarily isolate employees with signs of infectious diseases, and there was a likelihood of placing sites under quarantine with the need for offline operation. The quality of these routine checkups also changed. The workload also increased because and you all understand that when we try to hurry up, the quality deteriorates. So, as already mentioned, the temporary isolation of employees was one of the key problems, and sites placed under quarantine. What was the result of this? The employees split into two groups. The first part showed the tendency to conceal signs of diseases with late treatment and greater likelihood of complications and adverse outcome. And the other part showed that having no adequate medical assistance at their place of residence, people tried to use the opportunity of the medical centers on remote sites at their place of work. I would like to give you a case study of our recent experience. In one of our projects, a doctor had a situation when there was an emergency evacuation of an employee who just came to the shift. An employee with absolute medical contradictions to shift work with the potential for death, he arrived to the remote site. His health was in a very dangerous condition. He had some signs of pulmonary embolism, and he had to be evacuated from the site. It's good that the doctor had the necessary qualification and training, and she paid attention to this worker and took the necessary measures and revealed the case. What can be the consequences? These are the difficulties for the employer, additional costs to replace this employee, financial losses due to lack of a specialist in key position, and financial damage and damage to the reputation in case of the death of such an employee. What is required to solve and prevent such situations? Of course, we need not to present the problem, but to suggest possible solutions. First idea is to increase the number of medical means at the site. That is, we need to justify that in new conditions, in the new reality, we need more medical drugs, we need new medical means in order to act in some non-standard situations. Another thing is to provide additional medical means required for first aid and emergency care that we previously didn't take into consideration. We delegated, so to say, this function to the medical centers where we evacuated the employees. Next one is to provide additional medical equipment in case of urgent emergency evacuation, and then this may cause the problem of bringing the equipment, the necessary equipment, back to the remote site. To develop additional procedures such as isolation, disinfection, evacuation, and so on, and to provide additional opportunities for emergency evacuation and medical transportation. And right now, a few words about the problem that we didn't pay enough attention to: non-stable emotional state of employees. Right now, we try to pay more attention to this problem. Psychological component leads to the development of different physical disorders. But the mental disorder also negatively affects the efficiency of work, the performance of employees, and so on. But what are the key problems? Increased stress level, caused by intense workload, need to replace colleagues, perception of colleagues as carriers of an infectious agent. This is maybe something that we are exaggerating, but nevertheless there is such an attitude among the employees. There are two groups of people. Some people do not care about this pandemic, the others are too much concerned. Next one, emotional exhaustion due to extended shifts. The more a person is on a shift, the more difficult it is for him to be there and then come back home. Isolation from usual conditions and psychological tension in the family. These may be the potential problems. The solutions. The presence of a psychologist. 2 minutки еще осталось. Change of the working schedule and enriched nutrition and attention to physical activity. Since I do not have too much time to talk into details about these case studies, another example here is a situation that happened in a huge mountain project. But nevertheless, we need to make sure that medical support of non-shift workers at remote sites is also very important. And this requires additional measures that are listed here on this slide. These are not shift workers, but the workers working in offices or inter-shift workers. Physical well-being of an employee as a guarantee of fewer serious diseases and injuries, as well as lower costs for the organization and provision of ongoing and emergency medical care, is also a problem. Unfortunately, as experience shows, many employers are reluctant to this. They do not think this is important. And corporate health programs shall be extended not to office workers but to shift workers also. Now the conclusion. In the conditions of the new reality, which was formed under the influence of factors associated with the coronavirus pandemic, life presents us with new problems that require a wider view of the very concept of medical care, thus forcing us to go beyond purely medical issues, and as a consequence to provide a modern medical care system that will be effective in all respects. That is, increasing employer interest, providing a sense of comfort and security for employees, optimizing costs. It is necessary to focus on workforce resistance as an indicator of not only the momentary state of health of the workforce, but also an indicator that allows predicting the situation in the future. Извините, время заканчивается. Извините, пожалуйста, Евгений, но мы вынуждены вас остановить. Нам нужно оставить время для
education of medical personnel, employees, but also of management. This is a really international conference. This is an intercontinental conference. We have America, we have Europe, we have Asia, and we have Indonesia. My next speaker is my dear friend, Eddie Alpino from Indonesia. Eddie, no time to introduce you, so please go ahead. The floor is yours. You have beautiful batik shirts.
Yeah, thank you, Prano. Nice to meet you, even from long distance. Greeting from Jakarta, Indonesia.
Go ahead.
Okay, great. Can you see my slides?
Nope.
Give me a second.
Okay. Go ahead.
Yes, ladies and gentlemen, thank you. My name is Dr. Eddie, greeting from Jakarta, Indonesia. In this opportunity, I would like to talking about health technology systems in supporting medical services in remote locations and providing contribution in reducing morbidity and mortality in companies. As you know and aware that Indonesia is part of Southeast Asia, the biggest country in Southeast Asia. We have more than 13,000 islands. We call it from Sumatra to Papua. So it's very huge maritime country. In this opportunity, I would like to show you a little bit projects, what we are doing and what running now. Let's first in Tangguh, Papua. We have a very huge LNG project. In the right side, we also have Masela. Masela is a huge, and I think if I'm not wrong, it's the second largest LNG worldwide now, and will be running shortly. And there's also Jangkrik, operated by Italian company, oil and gas ENI. So this is only a third company. I mean, I will show you, this is our oil and gas map in Indonesia to 2020. So if you see this Sumatra Island, in the end of Sumatra Island, we call that Sabang, Sumatra. This is Java. This is Kalimantan. Some of you will recognize or familiar with Borneo. And this is Sulawesi. And the last one, in the right side, the biggest one is Papua. So from Sabang to Papua, we have a very huge thousands of oil well and LNG gas right now. So this is very challenging medical services. We're talking about not only onshore, but since last 10 to 20 years, we are more dominant offshore dominantly, sometimes hybrid or combined onshore and offshore. So we go through the main discussion. Since last 2 years, I mean, especially in pandemic area, we have a special application that everybody, before they start going to a location on site or remote area, they have to install application. Name is Pelindung Lindungi. Let's say in talking, I mean in English, sorry, in Bahasa, Pelindung Lindungi, more or less in English is Lindungi is care. So care of caring application that you can install by Android on app iPhone. So if you look this display, the live one, this is the performance of the Pelindung Lindungi. Everybody, especially employee, would like to go, let's say, to Sumatra, Java, until Papua. They have to install this one because what? once they install it, they will or they can see whether they already vaccine registration done or they have no registration yet. So if they already vaccine COVID-19, especially and for the future in other occupational health vaccine, they can pass and they can go to the location. However, if they scan or barcode and the vaccine registration cannot being found, so they cannot progress and they cannot proceed their transportation to the site. And also, if we see the second one is about the scan QR code. So this is very important because if you start, let's say, as an employee, before you check in, you just enter the airport. So in the door of airport, in the front of airport, there will be the barcode, and you can put and you can scan the barcode by this scan QR code by your mobile, whether in Android or iPhone. And the unique of this application also to ensure that all the occupational health employee, especially the employee person who like to go by aircraft or by other transportation like helicopter or in the port, something like that. So this application will ensure whether you already did your PCR swab or antigen swab, and how's the result. If the result so positive, means you can pass and you can proceed your transportation. However, if the result shows negative, means you cannot do that. I mean, you cannot proceed it, and there will some assessment that you have to go back to your home to do the self-isolation or other treatment. The other thing is important informations. There are some article, there are some notification in this application. Let's say if you go to somewhere on site, like Papua, other what kind of outbreak there, and what is the status of COVID-19 level there, what is the new cases, something like that, and what you have to do and what you have to don't. I mean, do and don't, it will be put in important information. The travel diary also sounds, also see whether you go to somewhere before, like whether you go to Sumatra or whether to other side, whether you go to all of Indonesia, even in Southeast Asia, they will put the itinerary what you have done, and it's mean that it's very good because you know which one of the location you should be aware, and if there is some location other thing that you have to do before you arrive there. Digital passports means that in the future they can put your digital passport, not only the real passport, but also for the health. What kind of your vaccination, what kind of COVID-19 vaccine, what is when the last PCR or when the last antigen swab have you been done, or have you been treated by COVID or something like that. And the last one is electronic health alert card. Electronic health alert card, I think, is already a familiar worldwide. It will be using worldwide, and there are some, let's say, checklists to be fulfilled once you arrive in the location or in some place. So the second one, what we have been implemented now is there is a application, another application beside the first that I have seen you. The second one is the telemedicine. So now everybody who work on site, let's say in the remote healthcare or in remote in-house healthcare, they can use these telemedicine services. If you see in the left side, primary care or in-house clinic, there's something happen. Let's say employee who's suffering chest pain or suffering other things that need consultation or other advice, they can send file or data image. Yeah, they can send file or data image to consultant provider. Normally it's a province hospital or specialist hospital, not in the center one, not in the capital one, but normally in the province. Yeah, and after that, yeah, once they receive, you can see that consultant provider will assess what is the diagnosis, what is the problem, yeah, that already being sent by the primary healthcare or the in-house clinic. So it means that if our company, if the project has in-house clinic, they can make collaboration, so they can use it once something happen and get the advice on the further treatment. So once the result has been done, the health analysis has been done, either in emergency or in non-emergency. So the consultant provider will be return back or send back the result to the in-house clinic, to the doctor on site.
Eddie, 2 minutes. 2 minutes left, Eddie.
And beside that, Indonesia also use some device continuous monitoring and health analytics. In some of companies oil and gas on site, they start with some watch, yeah, that can show and they can measure our blood pressure, our heart rate, and other things. Even can check the blood test and do the online doctor or the teleconsultant afterwards. So this one already done in oil and gas company, and it's very good, been proven to greatly reduce mortality and morbidity. This is local contents fabrication. The last one is about the wellness, that the SKK Migas as the Special Task Force for Upstream Oil and Gas Business Activities of Indonesia, they already start for the wellness program, yeah, for every employee that as a promotion and prevention, as well as hazard identification, a sustainable well program to prevent disease that pose a risk of death and optimize the health of employees. So employee can contact the nutritions by applications. Employee can contact dietary guidelines. Even they can ask how many calories they can take it. If they can pick, they take picture on site. The nutritionist or the application will return back with the advice whether is it okay for you or not okay, something like that, and how many targets and what kind of diet that should be done for your health. It's very specific and very good wellness application that has been done right now. Okay, I think that's all, Dr.
Yes.
Mika. Thank you very much.
Thank you very much, Eddie. I'm really impressed, and I think as everybody, for the countries that sometimes we call them third world country or developing country, you know, in certain aspects are much more developed than the developed countries. So thank you very much for this presentation. And we go for the moment, for now, for today's or this session's last presentation. It's Dr. Nahyan Helal. He is doctor consultant and the adjacent professor in occupational medicine and occupational health. His master degrees in occupational medicine and occupational health. Since then, he continued to studies on the field of occupational health until he obtained a PhD in public health, occupational medicine, occupational health as a major specialist. He's a leader, and I would say one of very few occupational health specialist in United Arab Emirates, and is also assistant professor from the College of Medicine at Health Science of the United Arab Emirates. Dr. Helal, thank you very much. Please, the floor is yours.
Thank you so much, Frano. Thank you so much. And we didn't see each other since 2015 in South Korea. We met that
Unmuted, unmuted, you are muted.
Yes, hello. Okay, good afternoon to everybody. I would like first to tell you that I'm so happy and glad to be in your country, the beautiful Russian, and also with the beautiful people like you. And it's my first time, and I'm so happy to be here with you today. And also thanks to Professor Sergi for inviting me to this beautiful third of the Remote Healthcare Conference, as well to Professor Karpov for his brilliant presentation, and also for all of you, and to CCM. What I'm going to go here just to explain to you regarding what established the first center in occupational health, as well as for the remote healthcare in the United Arab Emirates in Abu Dhabi. The idea of establish, this is myself, okay, just to go to establish of the HMC, Holistic Medical Center. And the idea of the center, our idea of this project actually, to provide different service to our client and oil and gas company. As you know, we are from extreme heat in deserts, and how we can provide the service in good manner and also quality and also faster. And the idea came of how to create a system that can provide the service for the occupational as well as the remote in the way of to connect with the all medical equipment devices. As you see here, we are a holistic medical center, as I mentioned before. And the idea of the system, I will show you now later on, that the timing of registering of any candidate, it just only takes 40 seconds, only. And the reason behind that, we're using the chip technology. As well, we establish our own occupational software, is the OHS. And also we have e-signature. And the data, it will be taken from the ID. That means there is no error. Meaning, we have zero. And also the idea of this, there is no paper. It's less. We are zero paper in this one. And also the consent form, immediately it will be as per the ID information we taken from the beginning of the registration. That means all this happened in only 40 seconds. This one helped us during the pandemic to pass or to give to some of the company providing the PCR and vaccine. They can make in one day, in place of to make it like 1,000, 2,000, they can make up to 40,000 cases. Because the information, signatures, all this happening just only in few times. You can see the picture, the name, all it's there in the system. What we did bi-directional. We communicate our system with all the medical device, in the way of before the patient or the candidate reach to the doctor, the all information will be in the place in the doctor screen. Similar, see the vital sign? That's why there's no typing or writing. Spiro and audio as well, and also the ECG. You can see here the sample of the Spiro, the information of the ECG is here in the screen, and immediately in second will be in your file. And the good thing is you're going to have a unique number that will be all your life with us. That means next time you will come, we have your data with us. The audio as well. It's here. You see X-ray as well. And the good of the X-ray, it can see remotely. Like if I'm here now, I can see the case done the X-ray in the spot of the center. in the same time. And I will show you now this one. The result remotely, we can see it. You can see, I can see it in my mobile, and I can look to it and I can give the result immediately without to delay the case. This is the one online that in my phone I can see. I will cross the X-ray. Okay, as I said to you before, we established this system from scratch, meaning we built it in our country from zero and to able to do a first occupational system that can provide the service for all the kind of occupational as well as remote. At the same time, connected to have bidirectional, meaning that technology we introduced to be able to connect with all the medical devices, meaning the speed, the quality, and also we're not using any paper for that one. Meaning in the end, you're going to have electronic file that will send to your company immediately after finishing your physical examination. Okay. This some of our sample of certificate, as I saw, and also if you fit or unfit your signature of the doctor, immediately will be a e-signature, like approve, and my name or the doctor name and his signature will be electronic one. Meaning, no need to look to the file in the end. You can be here and look to all the results, and you can fit the person, and you can also provide the certificate. This is sample for other company, for oil and gas company. They have standard of UK, and we follow all that one. And also this one is electronic one. All what you're seeing here is all electronic. We create a system also for follow between us, between the companies who are sending their employees to us to do the medical service or the occupational. Also, we follow them by the system, by tracking them in the same time giving to the company. We have also signature for that and also email sent to the company. We started, as I told you, since 2015, and we are running until today, 2021. And really, this system we created in 2015 helped us during that pandemic situation, because we can able also to contact company. Also, we can see candidates online, and we can also provide all the information, and also we can go to the site if needed, because we can use the system remotely. Like we can go to the site and do all the service on the site. As you see, Abu Dhabi, this is the Emirate of Abu Dhabi, all this site here. And we work more in the desert side, in this area. And that time, during the pandemic, we handled more than 7,000 PCR tests in the border of Saudi Arabia for Adna Group. And our main center is in Khalifa, and we open a other center close to the operation of the oil and gas in the desert side, in the Medina side. Meaning we came out to provide a service to their door or to the oil company in that desert area. I already mentioned about the system, how we create it and how it's working, and also the way the sample of medical checkup we do for here, for onshore, offshore, and other sample we do for collection, blood collection, and all the service for oil and gas and oil industry. We also create some of the packages based off the category of the service of the company, from food handler to oil and gas to driver, and etc. And this one help us to create this package from the registration time, meaning when the person come to us from the company and we know which category, from the registration they will select, and he would or she would proceed the service without any intervention for nurse or doctor, and they will follow exactly the package as per assigned by the company. Unless if anything doctor can order, it can also ability for that. All this is the package we do. Also, we work with SOS as well in Abu Dhabi. We do for them also the service. I don't want to go in details here. The majority of you know all the packages. What I want only to conclude to you in the end of this session, I want to only say to you that this is our branch in Abu Dhabi, this is our branch in Abu Dhabi, and this is the old branch, and we have the second branch in the Medina Zayed West in the western region, where is the oil, all the oil and gas company there. We did it in the way of speed up the service, meaning from the A to Z, it will not take from you 15 to 20 minutes for each candidate. And this is the reason why we established this a service for our clients. My conclusion in the end of this presentation, that technology really helped, because I believe in technology. From the beginning of this project, technology really helped us and really show how we can use the technology for provide a service to our clients in better, in quality, and fast. And especially during the pandemic, that really helped us to provide that service to our clients. Thank you very much, and I wish you a nice day.
Thank you very much, Professor Dr. Nihan. It was really a great example of how you brought the excellency in occupational health in United Arab Emirates, and of course, working on it. We have still 6 minutes of our session. There are many questions, but I will just choose one, and I'm asking Professor Antipov to give a 1 minute answer, okay? 1 minute, answering the question, what are the criteria for choosing healthcare provider in Russia?
Спасибо.
Thank you very much. 80% of providers, of customers that set the requirements for the providers are based on cost. 20% experience, I would say, and quality. Unfortunately, cost is the key aspect, especially in the current economic situation in the country. But we are not satisfied with the situation, unfortunately, at the moment.
Very much, Professor. Cost is always an issue, but then you have to see cost, quality, and efficiency of the service, which is sometimes difficult to convince the management that it's not only the cost, because what is cheap is not necessary of high quality, and vice versa. I have another question. 1 minute again, Paulo. Is it necessary to get special permission to control quadricopters in Brazil? And how can it solve the problem?
Please, can you repeat?
Is it necessary to get special permission to control quadricopters in Brazil? I suppose it's, the quads.
I don't know. It's quadruped.
Quad, the car which is open and has 4 wheels, it's completely open car. Quad.
Oh, okay. We have a traffic control. Then we need to obey this. And companies prepare a safety recommendation that we need to obey. And there is the government law that is applied. And you have government, company, and the conductor training.
Very good. Last, again, less than 1 minute, Suzanne. What a startup company in Russia can do for an Austrian company?
Sorry, what can the company do for?
what a startup company in Russia can do Austrian doctors have. What problem that can be solved by Russian startup do Austrian doctors have?
I don't really know if I understood the question, but what I see in many years of working now internationally, it's always so important to have local healthcare experience in the services. The more you collaborate with local people and maybe train them, if you face there some deficiency, the better the service will fit to the needs of the people in the country. You cannot only transform a service or an idea completely into a completely different other healthcare environment.
It's called sustainable healthcare. You know, the needs and knowledge of the local company or local community, and then to provide the best one. Well, my dear friends, dear participants, dear colleagues, thank you very much once again for all speakers. Excellent presentation. I suggest for the fourth conference to have a dedicated day for remote healthcare, because we have just scratched the issue and the problems of healthcare at remote locations. We saw about training, about standards, about emergency preparedness, about food, about feeding, about technologies. So really, there is a whole world ahead of us. But the biggest issue, I think, is to convince the management, companies, clients, contractors, subcontractors, as well as local governments, that working at remote sites has to have at least the similar, if not the same care as working in an urban environment. There is a big task ahead of us. I see here a lot of passion, a lot of knowledge, a lot of willingness to do for the interests of the employees and for the interests of the companies and, of course, of the communities we are living. We are perfectly on time. Thank you very much to organizer. Thank you very much, Professor Antipov. Sergey, I know you are there. Thank you very much, all the assistants, translators. I think this first session was really great. And what is fine, we are not disrupting in any way the continuation of the conference, because we are exactly on time. Really, thank you very much. And I hope to see you soon alive, all of you. We will be working. Suzanne and Paolo, we are in touch. Eddie, I know I'm following you closely. So thank you very much and for the session, and applause to all.
Спасибо. Я на правах...
Thank you so much. As a co-moderator, I would like to thank Frano Miko. It was just an awesome moderator. It was just really great. And he collected the speakers who shared the experience of organizing remote healthcare in Russia, in Europe, in Latin America, in Asia, in South Asia, in the Middle East. And as we can see, there are some things that are typical and basically the same for everyone, and some things that we can use in our work as the best practices from other countries to improve our work and make it even better quality. So I think we shared experience here, and I would like again to thank all the speakers. Everyone have a good day. Frana, we are